Meantime, today, Health Minister, the Honorable Dr. Dwayne Sands, is highlighting the danger that the comorbidities pose for the Bahamian populace. He told our Cleopatra Murphy today that the combination is worrisome.
Less than 1 month since the first reported case of the novel coronavirus in the Bahamas, and with 33 confirmed cases, the country has now recorded its sixth death, bringing the mortality rate to 18.18%. Minister of Health, the Honorable Dr. Dwayne Sands, commented on what appears to be a higher death rate relative to other countries with significantly more infections. He says common ailments among the population could have an impact on the death rate.
I think the numbers are small, but if you look at what we believe we know about COVID-19 is that the people that do worse are those with comorbidities and non-communicable diseases. The Bahamas is the poster child for non-communicable diseases. We have a disproportionately high rate of morbid obesity, of hypertension, of diabetes. You put that together with questionable discipline as it relates to social distancing, and you have the recipe for a perfect storm.
Similar to the Bahamas, New Orleans, with its high African-American population, has seen a death rate of 37.93 per 100,000 in comparison to New York, that leads the U.S. in cases of the novel coronavirus, but has a death rate of 18.86 per 100,000 people, according to the New York Post. Louisiana State Governor John Bel Edwards also cited similar prevailing health conditions among that population as a factor in the number of deaths. Sands says Bahamians must understand that the population is particularly vulnerable due to its comorbidities, and it should spur the public to be extra cautious amidst the COVID-19 pandemic.
That ought to mean that we should be even more disciplined in our social distancing strategies, not less. We didn't get here overnight. The evolution of NCDs in the Bahamas has been progressive. It has been intractable. And now with this virus, it brings all of these things home. So I think we can dispel with the myth that black people don't get COVID. I think we can get rid of that story, that COVID does not impact warm climates. We can get rid of that story.
The Bahamas has employed a 24-hour curfew among other strategies to limit the spread of the novel coronavirus that Sands admits may annoy some. He, however, says government is making the decisions based on the peculiar reality of the Bahamas.
And so we have to exaggerate the measures, the public health measures, if we want fewer people to die or fewer people to suffer.
To date, more than 1,400,000 confirmed cases of the novel coronavirus have been diagnosed, and more than 81,000 people have died. Cleopatra Murphy, ZNS Network News.